So I think there's a number of very interesting abstracts at ASH in the relapsed refractory mantle cell lymphoma space, and I just want to talk very briefly about three of those. So Pirtobrutinib is a non-covalent BTK inhibitor. It's been demonstrated to be highly effective in a range of different B-cell malignancies in the Bruin trial. And at ASH, in a poster, we're seeing an updated data set looking at these patients treated with Pirtobrutinib as monotherapy in the mantle cell lymphoma cohort. So 90 patients are included within this abstract. 82% of patients discontinued the covalent BTK inhibitor because of progressive disease. This is an older group of patients with a median prior lines of 3. Most of patients have received a prior CD20 antibody, prior chemotherapy, and of course, all patients have received a prior covalent BTK inhibitor here. Now, this updated data set demonstrates actually an increase in the overall response rate compared to what we've seen previously. So an overall response rate of 58% with a complete remission rate of 20%. And interestingly, the duration of response here looks just under 2 years, so 22 months. And the longer term follow-up is shown here. I think the median follow-up of the study overall is about a year here in this poster. The toxicity profile looks very good, and so what we've seen previously in terms of the toxicity of this treatment seems to be retained. So very good from a cardiac toxicity point of view, and also a range of other toxicities. So Pirtobrutinib data looks very interesting, and it may well be that we're not far off an FDA license for Pirtobrutinib in the hopefully relatively near future. Another abstract of real interest was data with Glofitamab. So Glofitamab is a CD3, CD20 bispecific antibody. We've seen data at last year's ASH on a small number of patients, so just over 20 patients receiving Glofitamab monotherapy, again in a very high risk group of relapsed refractory mantle cell lymphoma. And I think the kind of key take home really is that with longer follow-up and with more patients, the efficacy data really does seem to be still to be holding true. So the overall response rate looks to be over 80%, and the complete remission rate over 70% across all the cohorts. And so this looks extremely promising. And I think my personal view is that the bispecific antibodies, potentially this bispecific antibody, but there are obviously others in development, will play a key role in the management of mantle cell lymphoma in the future. And hopefully we'll see this product moving forward to randomized clinical studies in the future. And then finally, I wanted to just highlight an interesting drug called an interesting Ro1 humanized monoclonal antibody called Zilovertamab, and this is being studied in combination with Ibrutinib. There's an abstract on relapsed refractory mantle cell lymphoma and CLL. There are 27 mantle cell lymphoma patients included in this study. So these patients were all I think, naive to a prior covalent BTK inhibitor, but they received the combination of Ibrutinib and Zilovertamab here. And the response rate is 85%, CR rate 40%. The duration of response nearly 3 years, as is the median progression-free survival. So it looks interesting, certainly. And I highlight this because there's in the development and soon to be enrolling a study called the Zilo 301 randomized study, randomized phase 3 design. So this is with the aim for approval and registration of the combination. And sort of the key part of the design here is that patients enroll with relapsed mantle, start Ibrutinib for 4 months. And if you obtain a partial response or a stable response, you're then randomized to either continuing Ibrutinib or the addition of the Ro1 antibody, and patients are then followed subsequently. So interesting design, and kind of enriching for higher risk patients, or enriching for patients who are more likely to progress earlier, because they're not taking the sort of best players in terms of the depth of response at 4 months. But nonetheless, an interesting antibody, and certainly a trial in the future.